It can feel really worrying when you or someone else notices that your child may be developing differently. They might not be reaching their developmental milestones, or you may have concerns around developmental delay or a disability such as autism. It's a really confusing and difficult time for families, but we want you to know that you're not alone, there is help out there. To get support through services like the NDIS, we've broken it down into 4 simple steps that you can take. Step 1 would be to talk to someone that you feel comfortable sharing your worries with. That might be your GP or a child health nurse. Once you've spoken to the GP or the child health nurse, they might give you something called a referral, or they may not. If you do get this referral, it's a letter to another doctor or medical professional that will be able to support your child. These people often specialise in an area of healthcare or medicine. For example, a paediatrician specialises in the development of babies, children and teenagers. Whether you receive this referral or not, you can still get help. Step 2. If you do get a referral, there is the public health system and then there's the private health system. So the public health system is called the Child Development Service. Sometimes this is called CDS. So with the public service, there isn't a cost involved. However, sometimes there may be long wait lists. So it's always good to call them, just find out what their wait lists are. If you live in rural areas, this service is called the WA Country Health Service, and sometimes you might hear it called WACS. Now with the private health service, there will be a cost involved, but sometimes you might see that there might be shorter wait times for appointments. If you have Medicare or private health insurance, they may be able to cover the cost of the private health system because there is a cost involved in this system. Once your child has the appointment with the medical professional or doctor, they may tell you that they want to do an assessment on your child. They might want to do more than one assessment. Assessments are tests that look at your child's development. They'll be asking you lots of questions about what your child can do and what your child needs support doing. Step 3. If you didn't get a referral, you can send in a referral on your own. This is known as self-referring. You can self-refer to the Child Development Service, and you can also self-refer to Uplift, which was formerly known as Wansley, and they support children 0 to 9 to access the NDIS. If your child is over the age of 9, you can self-refer to Mission Australia or APM. Uplift, Mission Australia and APM, they can help you access the NDIS, also known as the National Disability Insurance Scheme. So the NDIS can help eligible Australian children and adults who are living with a disability. They can support your child to become more independent. They can help with learning new skills, and they also can help your child to access services within the community. Step 4. After the assessment with the doctor or medical health professional, you might need to wait a bit of time for the result. They will then contact you and you will go in, or they will give you a call and they'll be able to tell you the results. They may tell you that your child has a disability. You may hear the term diagnosis of a disability. This means they have found something different about the way your child's body or brain works. Once you have this diagnosis of a disability, you can share this information with services such as the NDIS, Uplift, APM and Mission Australia, and they'll be able to tell you what to do next and how they can support you. Don't worry if you don't get this diagnosis of a disability, and if you still have those worries for your child's development, the best thing to do is get back in contact with your GP, let them know the results, that you still have worries, and they will be able to help you further. This can be a really stressful time for families, and it's really important that parents and carers look after themselves during this time. We want you to know that the team at Kind are here to support you and help you navigate through these steps. Please don't be afraid to reach out and ask for our help. If your child has received a diagnosis of a disability and you're wondering what to do next, how to get support through the NDIS, just comment NDIS below and we'll make part 2 of this video. Thanks so much for watching.